Hello everyone, this is a video about the basics of low-dose allergen therapy and low-dose immunotherapy, also known as LDA and LDI. Just before I jump into the crux of the video, if you wouldn't mind taking a quick moment to like, share, subscribe, and or post a quick comment on this video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need any medical advice, please talk to your healthcare provider to get that advice. So someone sent me a direct message asking me to make a video about LDA/LDI, and I said I'd be happy to do that. I did also mention that I did post a video several years ago on my YouTube channel. It's a 45-minute presentation that I gave at a conference that was all about chronic Lyme disease and other complex chronic illness related issues, and so I created a 45-minute, or I re-recorded that after the fact and posted that on YouTube, so you can check that out on my YouTube channel if you're so inclined. And I've also posted other videos on Instagram and YouTube and other places, wherever you're watching this video, probably somewhere on that platform, that talk about LDA and LDI. But so I asked the person who sent me the question, did you have specific questions around it? And so she said, yes, I do. And so I will answer those specific questions. And there's some good kind of like fundamental questions about LDA and LDI. So hence kind of referring to this as going over some of the basics. So she was saying that she's curious about how LDA/LDI is administered. So traditionally, LDA, low-dose allergen therapy, is administered as an injection. What many clinicians, can't say the exact number, but just at some of the conferences and CE events where we chat about these things, courses that we take and whatnot, I know that a number of us have moved away from doing that it as an injection. It can still be done as an injection, but a lot of us has found that using it as an oral treatment seems to work just as well. There are certainly some folks out there who say like, nope, the injections definitely work better. I just say the proof is always in the pudding. If I see that the injections or the oral dosing is working just as well, then I give patients the option, and virtually everybody says, hey, let's try the oral dosing, but it can be used as an injection. Advantages, of course, of not injecting it are that it doesn't hurt. We can administer it to kids a lot more easily, and depending on the clinic and who's involved in all that, it could also be quite a lot less expensive, which is definitely the case at our clinic. So that's how it's administered. Oh, so it's administered as drops underneath that one would put underneath one's tongue, either squirting that under the tongue with a little pre-filled syringe, or in our clinic we just kind of rig it up so that it's in drops. You can just put the drops under your tongue. In terms of safety, generally speaking, in my experience, LDA and LDI are very safe, especially when it's LDA, which is for food sensitivities, environmental sensitivities to things like kind of naturally occurring things that people might be allergic to in the environment, like pollen, pet dander, trees, grasses, mold, yeast, that type of stuff. And it can also be used, and there's also a chemical mix for synthetic chemicals that are not natural at all. So the LDA, in my experience, is generally very well tolerated. There are certainly some folks who flare from it. But in cases where folks are really sensitive, we'll usually start them at a lower concentration and gradually build it up to try to avoid flares. LDI, low-dose immunotherapy, which is very, very similar to LDA, just using different formulas. So for LDI, rather than using that for, say, food sensitivities or chemical sensitivities or whatnot, we'd be using that for folks having reactivity to different infectious microbes like Lyme-causing bacteria, Borrelia burgdorferi, or co-infections like Babesia or Bartonella, or possibly hormone sensitivities to things like estrogen or progesterone, or potentially other things as well, though those tend to be kind of the heaviest hitters. But there are LDI formulas for fluoroquinolone antibiotics and for salicylates and a wide range of different things. So there are lots of niche LDIs. So in terms of the safety of LDI, to my understanding and in my opinion and based on my clinical experience, I think that LDI itself is very safe, that it doesn't have any toxic effects from it. It's not like, oh, I'm taking, I don't know, iodine as a supplement and like it could potentially trigger hyperthyroidism if I take too much. It's not like there's that type of built-in like potential toxicity or side effects per se, but it is certainly feasible that if the dose of LDI is too high, it can cause a person to have a reaction to it, whether it's a inflammatory reaction, whether it's a mast cell mediated reaction, whether it's some type of a Herx reaction potentially. So it's safe, but it does need to be used responsibly. I haven't seen this firsthand in my practice because I don't practice this way. When I teach my residents how to use low-dose immunotherapy and allergen therapy, I teach them to use it the way I use it. My colleagues that work here with me, we all use this in a very, I think, responsible way. I have I have heard stories through the grapevine, though, of some clinicians who kind of use LDI and they're saying, like, unless you're flaring from it, it's not working. So like some people can get really flared up using that type of, in my opinion, very cavalier method that I do not understand the rationale behind. But I've also never talked to one of those docs, so maybe they have really good intentions and get really good results. I don't know. I'm sure they have good intentions, but maybe they have a really good rationale, I should say, and get really good results. I don't know. But generally, it should be a very well-tolerated therapy. If it is causing flare-up symptoms, then in my opinion, in my experience, it means the dose is too high and should very likely be walked back, but there's different approaches out there. So the questions further go on to ask about if it's being used for food sensitivities, does one need to know which foods they are sensitive to, or does it help with all foods? So great question. So the food mix has the traditional LDA food mix has, if memory serves, a little over 100 different foods, much to my chagrin, because I really like knowing what's in stuff. It's a proprietary formula, so we don't know exactly what's in the food mix, which I don't like that fact, but that just is the fact of the matter. But to my understanding, there's approximately 100 foods or so in there, and they're all the foods that you would commonly find in a stereotypical North American or Western European grocery store. Whether there are foods that would be more common in other cultures, I'm not really sure, but it's going to include all of the, at least from a North American perspective, like all your standard vegetables and fruits and grains and proteins and things like that, like beef, chicken, turkey, fish, different stuff like that. Does it have every type of shellfish in there? Probably not. If it's around 100 foods, maybe it's 150 foods. I don't remember the exact number, but it does have a wide spectrum of foods in there. So we don't actually need to know what a person's allergic to use food LDA or any of the LDAs, because it is a broad spectrum formula. So it's either going to help or it's not. Or again, if the dose is too high, it could potentially cause a flare up. It's like, oh, I'm allergic to like X, Y, or Z food. Well, it's the same one size fits all formula. It's just this combination food mix, as it's called. So one does not need to know what food they're sensitive to. Now, I suppose if a patient came in and said, I'm sensitive to ugly fruit or dragon fruit or something like that, which maybe it's in the LDA mix, I don't know, but my guess would be probably not, because it's not the most traditional fruit or vegetable in a North American centric kind of society. Then that if that was what a person was allergic to and they just couldn't live without their ugly fruit, I'd say, well, we could try it, but it probably won't help because I don't think there's ugly fruit in there. Now, the cool thing with LDA and LDI is that there is the potential to make novel formulas. So LDA and LDI, there's nothing magical in there. It can be a very magically wonderful therapy in terms of how well it can work for folks, but it's basically just a serially diluted formula of the allergen in question. It's like when a person goes to an allergist to, say, get allergy shots for their dust allergy. It's not like there's some magical anti-dust particle in there. It's just diluted, sterilized dust. They're injecting a diluted version of the stuff the person's allergic to. It's the same kind of concept with LDA. So if a person was like, I gotta eat my ugly fruit, but there's no ugly fruit pre-made LDA, we could technically take some macerated ugly fruit and then kind of dilute it down, and if it needed to be injected, I guess one could sterilize that. There's processes to do that. So anyways, I'll leave it there as far as that goes. But I hope I think that covers all the questions. So ending on an ugly fruit note, my favorite note to end on. There was one further question here. We'll end on a different note. And the question is, does it come from a pharmacy? So LDA is available through a couple of sources, like a traditional official LDA, if you will, like what's been around since the 1960s when it was first developed. That LDA is only available through certain pharmacies. There's a Canadian pharmacy that produces it. There's an American pharmacy that produces it. There is another option. There's another source of kind of an LDA-like formula that was put together by a doctor who kind of said, hey, you know what, I want to make my own kind of custom version of this. And so that there is kind of a non-pharmacy version that's available as well. That's also out there, but it does come from a pharmacy most traditionally. But it is something that has to be ordered through a clinic. It's not like you can just pop into your local, I don't know, Shoppers Drug Mart here in Canada. I think maybe Walgreens is a common chain in the US. I can't really remember. Anyways, you can't, not like you can just walk in and get it over the counter or something like that. It has to be mediated through a clinic. Thank you for the questions about this. If anybody has any questions or comments about LDA or LDI, please feel free to post in the comment section below. If you yourself have used LDA or LDI and found it to be very helpful, very unhelpful, anything you want to share in the comments, love to hear about it. And if you have any questions about complex chronic illness or anything really health related, feel free to post in the comment section below, and I will do my best to answer as soon as I can.